Hello, beautiful souls, and welcome back to Relatos de Ternura. I'm here with you today, and I want you to know that whatever brought you to this video, you're not alone in your journey. Today, we're going to talk about something that affects millions of us after 50, blood pressure medication. But this isn't just another medical lecture. This is a heart-to-heart conversation about your health, your choices, and most importantly, your right to feel empowered about your well-being. If you're over 50 and taking blood pressure medication, or if you've been told you might need to start, I want you to take a deep breath with me. What I'm about to share might surprise you, but it's information that could genuinely change how you approach your health care. You deserve to know the full picture. The reality check. Let me start with a truth that might shock you. Nearly half of all adults over 50 are prescribed blood pressure medication. But here's what your doctor might not have fully explained. These medications often come with a complex web of side effects that can significantly impact your quality of life. I remember Maria, a vibrant 52-year-old teacher who came to me feeling defeated. She'd been on blood pressure medication for 2 years and told me, "I feel like I'm living in a fog. I'm tired all the time. My memory isn't what it used to be, and I've gained weight despite eating less." Maria's story breaks my heart because it's so common, yet so preventable. The shocking truth is that while blood pressure medications can be life-saving, they're often prescribed too quickly without exploring gentler alternatives first. Your doctor means well, but in our fast-paced medical system, writing a prescription is often easier than taking time to discuss lifestyle modifications that could be just as effective. Many of us accept that feeling tired, dizzy, or experiencing decreased libido is just part of aging. But what if I told you that these symptoms might be side effects of your medication, not inevitable consequences of getting older? You have the right to feel vibrant and energetic in your 50s, 60s, and beyond. Understanding your body's wisdom. Your body is incredibly wise, and sometimes what we call high blood pressure is actually your body's intelligent response to stress, inflammation, or nutritional deficiencies. Think of blood pressure as your body's internal communication system. It's trying to tell you something important. I want you to understand that blood pressure naturally fluctuates throughout the day. It rises when you're excited, stressed, or active, and it lowers when you're calm and resting. This is completely normal and healthy. The problem arises when we take a single reading during a stressful doctor's visit, what we call white coat syndrome, and base long-term medication decisions on that moment. Consider James, a 55-year-old accountant who discovered his blood pressure was only elevated during tax season. Once he learned stress management techniques and made some dietary changes, his numbers normalized without medication. His doctor was amazed, but James wasn't surprised. He had started listening to his body's wisdom. Your body wants to heal and find balance. Sometimes elevated blood pressure is your body's way of saying, "I need better nutrition," "I need more movement," or "I need to reduce stress." Before we silence these messages with medication, shouldn't we first try to understand what your body is trying to tell you? The side effects nobody talks about. Let's have an honest conversation about the side effects that often go unmentioned. Beyond the fatigue and dizziness, many people experience cognitive changes, difficulty concentrating, memory issues, and what some describe as brain fog. These aren't minor inconveniences. They're quality of life issues that can affect your work, relationships, and overall happiness. Sarah, a 58-year-old grandmother, told me she stopped reading books because she couldn't concentrate. She thought it was just aging until she worked with her doctor to adjust her medication. Within weeks, she was back to reading 2 books a month. These cognitive side effects are real and they're reversible. There's also the emotional impact. Some blood pressure medications can contribute to depression or anxiety. You might notice feeling less motivated, less interested in activities you once enjoyed, or experiencing mood swings. These changes can strain relationships and make you feel like you're losing yourself. The cruel irony is that chronic stress about side effects can actually raise your blood pressure, creating a vicious cycle. You take medication to lower your blood pressure, but the side effects cause stress, which raises your blood pressure, leading to higher doses or additional medications. Natural alternatives that actually work. Here's where hope enters the picture. There are natural, scientifically backed approaches that can be incredibly effective for managing blood pressure. I'm not suggesting you throw away your medication tomorrow. That would be dangerous. But I am suggesting you explore these options with your healthcare provider. First, let's talk about the power of food as medicine. The Mediterranean diet has been shown to lower blood pressure as effectively as some medications. We're talking about delicious foods like olive oil, nuts, leafy greens, and fatty fish. Imagine managing your blood pressure with a plate of salmon, avocado, and mixed greens drizzled with olive oil. Doesn't that sound better than a daily pill? Potassium-rich foods like bananas, sweet potatoes, and spinach can naturally lower blood pressure. Dark chocolate, yes, you heard that right, contains compounds that help relax blood vessels. These aren't just feel-good suggestions. They're backed by solid research. Movement is another powerful medicine. You don't need to run marathons or lift heavy weights. A daily 30-minute walk, gentle yoga, or dancing in your living room can significantly impact your blood pressure. Exercise strengthens your heart, making it more efficient at pumping blood with less effort. Deep breathing exercises, meditation, and stress reduction techniques can lower blood pressure within minutes. I teach my clients a simple technique. Breathe in for 4 counts, hold for 4, breathe out for 6. Do this for just 5 minutes, and you'll likely see your blood pressure drop measurably. Working with your doctor, the key is becoming an active partner in your healthcare, not a passive recipient. When you next see your doctor, come prepared with questions. Ask about your specific numbers. What exactly is your blood pressure, and how does it compare to previous readings? Request to see trends over time, not just single readings. Ask about lifestyle modifications you could try before starting medication or while gradually reducing it. Most doctors appreciate patients who are engaged and proactive about their health. If your doctor seems resistant to discussing alternatives, remember that you have the right to seek a second opinion or find a provider who supports a more integrative approach. Keep a blood pressure log at home. Take readings at different times of day and in different situations. This data is incredibly valuable and helps both you and your doctor understand your unique patterns. You might discover that your blood pressure is only elevated in certain situations or at specific times. Consider working with a functional medicine practitioner or a naturopathic doctor alongside your conventional physician. These professionals specialize in addressing root causes and supporting your body's natural healing processes. Your empowered next steps. I want you to leave this conversation feeling empowered, not overwhelmed. Start small. Choose one area to focus on this week. Maybe it's adding a 10-minute walk to your daily routine. Or perhaps it's incorporating more leafy greens into your meals. Create a support system. Share your health goals with family and friends. Having people who understand your journey makes all the difference. Consider joining online communities or local groups focused on natural health and wellness. Most importantly, trust yourself. You know your body better than anyone else. If something doesn't feel right, speak up. If you're experiencing side effects that are affecting your quality of life, don't suffer in silence. Your well-being matters, and you deserve to feel your best. Remember, making changes after 50 isn't just possible. It's often more effective because you have the wisdom and motivation that comes with experience. You're not too old to take control of your health. You're at the perfect age to prioritize it. As we wrap up today's conversation, I want you to remember that you are not a statistic. You're a unique individual with your own health story, and you have more power over that story than you might realize. Your blood pressure numbers don't define you, and taking medication doesn't mean you failed. If today's message resonated with you, I encourage you to share it with someone who might benefit from hearing it. Leave a comment below sharing one small step you're committed to taking this week. Your story might inspire someone else to begin their own journey toward better health. Remember, beautiful souls, taking care of your health is one of the most loving things you can do, not just for yourself, but for everyone who loves you. You deserve to feel vibrant, energetic, and fully alive at any age. Thank you for spending this time with me today. Until we meet again, be gentle with yourself. Trust your body's wisdom, and remember, you have the power to write your own health story. Take care, and I'll see you in the next video.